Hello and welcome to the Feeling Good podcast. I am your host, Fabrice Nye, and joining me here in the Murrieta studios is Dr. David Burns. Hi, David.
Hi, Fabrice.
Dr. David Burns has been a pioneer in the development of cognitive therapy, and he is the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 20 languages. He is an emeritus adjunct clinical professor of psychiatry at the Stanford University School of Medicine. Welcome to episode 128 of the Feeling Good podcast. We're going to riff off a letter from a listener today, but the main topic on this episode, and we might actually have some follow-up ones on this, is about social anxiety. David, you got a letter from somebody named Dan, is that right?
We'll call him Dan. I think his real name is quite different. But
okay.
I've had a lot of requests for shows on social anxiety and shyness, and so after this one, we'll also have some additional shows on social anxiety. We're just going to focus on one little narrow slice of it in this show. But I might preface it by saying that there are many kinds of social anxiety, and I've personally had just about all of them. I think there's 5 or 6 or 7 different kinds of social anxiety.
What are they? I'm not sure what you're referring to.
Well, there's shyness, anxiety around other people.
Okay.
There's public speaking anxiety. There's performance anxiety.
Isn't that the same as public speaking? Which is
like any kind of performance. It could be athletic performance or musical performance or anything like that. You can have shy bladder. Or some people have shy bowel syndrome, fearing they won't be able to pee in a public restroom or poo in a public restroom.
Okay.
There's test anxiety is considered a form of social anxiety by the American Psychiatric Association, for better or for worse. There's 1, 2, 3, 4, 5. I had camera anxiety until about a year and a half ago. It was intense from childhood on. But in general, the theme is being anxious about being judged by other people.
Right, yeah.
So here is Dan's letter, and I apologize for being slow responding to it. He wrote me a couple of months ago, and I exchanged some emails with him. I might have sent you copies of them too. But he says in brief, he starts out by saying that my book, When Panic Attacks, and the Feeling Good podcast we've been doing have not only saved my life, but they've made me successful in starting a family and finding gainful employment.
Wonderful.
So, and I get a lot of those. I try to send, many of them to you, but there's a lot of them.
Yeah.
In brief, I've been tormented by anxiety for about 8 years, and I moved to Mississippi. I'm just disguising the location to protect him. When I was 20 and suffered the usual things of an immigrant, including social isolation, long work hours, culture shock. I also lived with a father who suffered from paranoid schizophrenia, and I took care of him. I also suffered from severe acne, which erupted after 6 months of moving to Mississippi. After 6 years of suffering with acne, I became hopeless and severely depressed. I was put on some medication by a psychiatrist, but it did nothing for me. My depression lifted when a dermatologist prescribed benzocycline, which resulted in 99% clear skin. So that's a great thing.
Okay, that's good.
After my skin was cleared, my life changed. I quit the antidepressants, completed a degree, found good work, got married, and had a child. However, I feel that my past trauma impacted my psychological well-being. The acne suffering made me very self-conscious! Now, he worked a few sessions with the team therapist, quite a good one, actually, and they did kind of, as far as paradoxical agenda setting, to say, what does your anxiety show about you that's positive and awesome? And he found that that helpful. He just didn't continue with the treatment, but he saw many positive things in his anxiety. He says it's like it's been a survival mechanism, and with his acne, his anxiety drove him to find a solution to the problem, and it's been an engine that's motivated me and made me very successful. He came to America with only a high school education and barely spoke English, and completed a degree as a top student, and landed in a highly competitive job, and completed months of training, ended up again the top of the program. And he's currently a father, a husband. He works, he runs, he swims, he trains in martial arts. He's attended Toastmasters and so forth. And
he's quite successful.
Very, very successful and hardworking. And he says, I feel my anxiety served as my drive to compensate for my beauty deficit and also to prove to family and others that I'm worthwhile.
Yeah.
And then he's used some team methods, and he really benefited from thinking in shades of gray, externalization of voices, and exposure, but hit rock bottom in 2015 and was very socially anxious. Came about your book and started, implementing the techniques. I realized that to lose my fear of social situations, I would need to expose myself to them. I also realize this is an incremental progress. I've made strides ever since, but I feel I cannot face certain situations due to extremely high anxiety. And here's the thing he wants help with.
Okay.
In certain situations, my heart races, I tremble, I have a shaky voice, I can barely talk, and my mouth twitches. I've done a lot of incremental exposure, mindfulness meditation, self-hypnosis, physical workout, yet the problem persists. I'm currently taking some CBT and clinical hypnotherapy in the city I live in, and I've taken some online therapy sessions with the therapist that helped me with the resistance stuff that we just went through. However, I've not been able to crack my physical symptoms in certain situations. In experiencing physical situations, when I have physical symptoms, here's my thoughts. I'm about to lose control over myself. Others will see my symptoms and think I am mentally insane. In spite of making Herculean efforts to control these symptoms, I have failed. Again, the attempt to control the symptoms is the cause of the symptoms, as we were talking about just recently.
About that, yeah.
I will never overcome this. 6, I'm defective for life. 5, I will lose my job. And then there's more on the next page. In certain performance situations, I find myself trembling with shaky voice and mouth twitching. This experience feels like a panic attack. I'm not able to perform. I can barely talk. Others will see me and think I'm mentally insane. I feel I'm losing control over myself. I understand that ideally I would face this fear. However, due to the nature of my work, I'm required to answer promptly and be in control of the situation. What should I do? Thanks, Dan. Well, we can brainstorm together here, but in general, I don't throw methods at a problem. But we're going to do that today. We're going to make an exception.
Yes.
But I work with people systematically, and I would take a thought and put it in a recovery circle and choose 15 or 20 techniques to crush that thought. Like people will think I'm mentally insane or whatever it is.
Yeah.
But I thought what we might highlight here, just to keep it somewhat simple, is how to do the exposure, because he needs to do, it seems to me, self-disclosure, the experimental technique, and shame attacking exercises.
And I would say survey technique also.
Yes, perfect, and survey technique. Now, those would be 4 among 20 or 30 techniques on a recovery circle.
Now, before we go there, I'm not sure, and maybe I missed it. How did he define the situations that led him to have those physical symptoms?
Well,
what was the specifics of that?
In certain, he's a little vague on that, but I think it's when he has to perform in front of people. He mentioned, like, if in his work he should have to pin somebody down like an intruder or something like that, or if it looks like if he has to speak in front of a group, kind of a performance anxiety. In certain performance situations, I find myself trembling with shaky voice and mouth twitching. Okay. This experience feels like a panic attack and leaves me feeling bewildered and hopeless. So we might have to kind of make up what it is. There's, let's see, he says public speaking is one of them. Performing in an official capacity or being in a heated argument with someone. Mm-hmm. Those are, I mean, I could read more stuff here, but...
okay. Just wondering if we had something specific to hang our hat on, you know. Yeah, I should have asked him to do a specific daily mood log, but you know, as we get an event. But I don't think I've got this here. Mm-hmm. But he mentions you know, the Fab Man. I'm asking, what are your most frightening situations? And then I said, are you open to smile and low practice smile, shame attacking, self-disclosure survey, and as well as feared fantasy? Downward arrows is really good too. I had mentioned those things, and then he came back and said public speaking, performing in an official capacity, and kind of like that, but also feared fantasy. So there are those situations where Dan is having these physical symptoms. So what's the thinking here? You know, we just listed 4 different methods that would be appropriate. Or 5, because we can add feared fantasy. Oh, yeah, okay, yeah. All those methods are some kind of exposure, really. Yeah, right. Even the experimental methods. Yeah. You do expose yourself when you practice them. Yeah. So it's all about putting yourself in the situation that normally creates the symptoms. Right. And do various practices with that. Yes. Now, if I'm working with Dan, I would have to dangle the carrot and say, I believe we can work with this really well. And you've already used a lot of techniques, and there are more, but you've done well with the ones that you've used. But the ones that you're shying away from are the exposure techniques. And if you want me to work with you, you'd have to agree to do them, even if they make you tremendously anxious. Yeah. And, I'll go and I'll do them with you. I'll go with you to the gates of hell. But this would be mandatory. Now, I can't treat Dan, and you can't treat Dan through a podcast. So that's right. These are things that perhaps Dan could negotiate with his current therapist and get some support and guidance from the therapist. But let's talk about how each of these techniques might work for Dan, because we do this stuff all the time on the hike. And I'll give an example. I think I gave on a hike I mentioned on a recent podcast, but someone in our group, I guess I won't mention her name just to protect her identity, but she's actually a therapist and someone you know. And she came on a recent hike because she needed a tune-up, and she reminded me that she used to have in the Tuesday group her face twitching like Dan, and she would try hard to control it and hide it. Yeah. And of course that made the symptoms worse. And what I told her to do was to announce it in the Tuesday group. Yeah. Something she didn't want to do. Mm-hmm. And she fought against it. And then she found tremendous outpouring of love and warmth and support. And her anxiety disappeared. And then, she came on a hike a couple years later that it had fired up again. And so on the hike, she told me this, and we had about a dozen or more on the hike. Most of the people I didn't know. I don't know where they all came from. They showed up at the front door for the Sunday hike. And so I said, I want you to announce to these people what's going on. And she said, well, I'm feeling it even right now. I feel like my mouth is twitching, and I think they're going to look down on me. And then I also stopped some other hikers. I said, could you stop here for a minute? This woman has an important announcement.
And then I forced her to say this to the group. And not only were they not critical, they just...
So that's self-disclosure.
Yeah, self-disclosure, and also the experimental technique to say, how do you feel about me?
So that would be the survey technique, which is a form of experimental technique.
Yeah, and they were all very loving. And the weird thing is this couple that stopped said, "Oh, are you a therapist? Our daughter has that problem too. Can we refer her to you? Give us your card." And then they referred their daughter to her. It was just the opposite of what she thought, that people would be looking down on her. So the first thing Dan would have to be willing to do is to share this with people, his colleagues at work. Yeah. And he's afraid he's going to lose his job. I don't think he's going to lose his job. He sounds like a very high performing individual. I had another example of doing this, and Dan has to figure out how to do it, but he could just go out on the street and go up and approach people like we do on the Sunday hikes. I stop people and say, "This person wants to talk to you." I did it down in Woodland Hills. The fellow who did the volunteer for the live demonstration at a workshop was a therapist who'd had crippling public speaking anxiety and shyness since childhood. And he'd been hiding it, and he was like 64 years old. Mm. And I got him to just share it with the group and just tell the group, and people just responded to him so warmly. And he felt close to people for the first time. And then afterwards, I took him out in the hall, and I think I probably mentioned this on a previous podcast, but I said, now you have to go up to strangers and tell them that you've been shy all your life and you've decided to open up and tell people. And he said, "Oh, no, I can't do that." I said, "Oh, you can do it. You're going to do it right now." And I just grabbed the security guard. I said, "This guy has to talk to you right now." Of course, the security guard thinks it's an emergency, and then he spit it out. And the emergency guard just practically kissed him and, was just so warm and supportive. And he couldn't believe it. Then he went around and talking to all these people in the hotel lobby. And he just got wonderful feedback from people. So that would be the first thing I would demand that Dan do, and that's called self-disclosure and survey technique and experimental technique.
Yeah. So self-disclosure, meaning telling people what you experience inside. Survey technique, asking people what they think about it. And experimental technique, you have some idea about how things are going to go. You for example, you're thinking, "Oh, they're going to reject me if I say this." Yeah. Try it out and see that it actually doesn't happen.
Right. Now, these things can be done skillfully or unskillfully, and there's couple tips as to how to do it skillfully. Uh-huh. The way you do it skillfully is you say, "Could I speak with you for a moment? I want you to know that I've been shy for many years, and although I'm pretty successful, I have this flaw. And right now I'm feeling it, and in public speaking I feel it. I get really nervous and scared, and I've been hiding it because I'm ashamed." Yeah. That's what you have to say. Yeah. And I've decided not to be ashamed anymore and to start telling people. And that's why I'm telling you. Mm-hmm. That's how you do it. You don't say, "Oh, I'm real nervous. What do you think?" Because that's very different. You see that, Fabrice?
Well, there's not a lot of self-disclosure. You don't really tell people why the heck you're talking to.
Yeah, and so then you put the other person on the spot, and they feel like they have to pity you.
Yeah.
So they'll say, "Oh, there, you're a good person," or something. It'll be like a total flop. Yeah. So you have to say it the way I'm saying it. And that I found is pretty universally effective. Now, there's a couple other things about it. You have to be a little bit smart. Like, I'm not sure I'd tell a black man to go into Wanamaker's white department store at the Stanford Shopping Center and do this. Mm-hmm. To go up to women, because then they might be frightened because of their racial prejudice that some large black man, you know what I mean? Yeah. And then they might call a security guard. It might backfire. So when you use these powerful techniques, you have to use them in a thoughtful manner. Yeah. But all that being said, I think Dan could do this with strangers on the street. He could do it with people he works with. And you know, I've done this myself tons of times. And it's so helpful. It's so helpful to me. And when I try to hide my anxiety, my shyness, it's the cover-up situation that's where the pain comes. It's not the anxiety or the shyness, but the shame and the cover-up operation that does all the destruction. And he could even say, and sometimes I just feel like my face is twitching. That's what I told the woman to do on the hike. I'm not mentioning her name. I said, make your face twitch. And I told the people, let's all twitch our faces now. You know, and then she started laughing. You know, it's like when you meet the monster has no teeth. But once you're afraid of the monster, you're trying to control your face, it'll twitch even more. You know, he could just walk up to someone and twitch his face and say, sometimes my face twitches and it's twitching right now. And people might laugh with him. It's to accept it. So any more comments on these first three before we go to shame attacking and feared fantasy?
No, I think that we've covered the terrain.
Do you think Dan will do it?
That I don't know.
It's like jumping off the...
Well, we could be talking to Dan right now and say, Dan, so we're doing this for you. We're really hearing you on the letter you sent us, and see if you're willing in response to actually step up to the plate also and do this.
Yeah.
And then write to us and say how it went.
Yeah. And it's going to be like jumping off the high dive in the swimming pool for the first time. It depends on what price are you willing to pay to recover from this thing. Well, that's level one we just mentioned, and then level two could be shame attacking exercises, and we do these on the Sunday hikes all the time, and that's where you actually make a fool of yourself in public. Now, Dad, maybe you want to drive to a nearby city and do this or something if you want, but you could just walk downtown and then start trembling and shaking and saying, "Oh, I'm a crazy man. I tremble and shake all the time." And then see what happens.
Yeah, in fact, you told me that you have a list of exercises that can be used as shame attacking exercises.
Yeah, maybe should I post that with this episode?
Sure, why not?
Yeah. And we know this guy in Australia. Tell us about him.
Yeah, he wrote to us that he formed this group just based on what we're talking about here about shame attacking exercises, and this group has begun to just do shame attacking exercises as a practice.
Yes, and I think he's got 200 people have joined his shame attacking group.
I think this is wonderful. I wonder if this could become a movement of people doing shame attacking groups and having
all over the United States. Yeah, absolutely. Because he said now a group has started in New York City, and they got 50 people who get together and do shame attacking exercises. Yeah. And I'll publish with this episode a list that I have of 150 shame attacking exercises. Yeah. He sent it to me, but a lot of them were just ones he got from my workshops, and then he made some up. But it's just doing something crazy in public to get over your fear of doing something crazy in public. And it's incredibly hard at first, but you discover that the world doesn't come to an end. Now, again, you've got to be careful, because we went over to the Stanford Mall with my Tuesday group about 6 months ago, and we had everyone doing shame attacking exercises. Yeah. Doing bizarre things in the Stanford.
I know you tried to record that. We didn't get very good sound.
Yeah, I didn't know how to use it. It was just too noisy, and I didn't know how to use the recorder properly. But the security guards did come up to us, to find out if we were going to be a danger there, because we were doing bizarre things. Yeah. Like leaping through the air, inviting people to go leaping through the air with us, and lying on the ground, and encouraging people to lie on the cement with us, and going and saying crazy things in stores. But then when we told them what we were doing, they decided they really liked it, and that it was fine, and they were kind of supporting us in it. But you have to be sensitive and not do something that will threaten other people. And you want to make a fool of yourself, not make a fool of other people. Yeah. I would never do shame attacking exercises in a hospital, for example, but it's okay to do it at the mall. And again, you want to think about racial or other issues that could come up there. If you're living in Mississippi, there could be some strong, racial feelings that people have. And so you have to take all of these factors into account. Yeah. But all that being said, it's tremendously liberating. And then how would and strongly recommended, the first time I did one, it was so hard, I didn't think I was going to be able to do it, but the people I was with just pressured me into doing it, and I did it, and it turned out to be fun, and the world didn't come to an end. It's like enlightenment. It's just like seeing something you've never seen before. Yeah. But how would a feared fantasy work, Fabrice?
So the feared fantasy, this is typically set up as a role play. And so, in this case, Dan is afraid of being judged. And so you set this up with Dan essentially confronting the people that he fears will be judging him with the following conditions. They actually will be judging him to the largest extent that he's afraid of, number one. Number two,
in a fantasy exercise. In the
fantasy, yes, of course.
We're going into a fantasy world, Dan, where your worst fears come true.
Yes. Not only that, but they actually will be totally candid about it and tell him how much they're judging him.
Yeah. So you'll meet the people from hell who not only have these bad thoughts about you, they get right up in your face and try to humiliate you. Yeah. And so then we'd ask Dan, what do you think people would be thinking about you if your face is twitching or you're looking nervous? So his first thought is, they'll think I'm crazy. Yeah. So you write that down. And Dan, what are some other things you're afraid they'll be thinking about you?
They're going to think I'm worthless.
Okay, I'm worthless. And any other thoughts?
They're going to believe that I shouldn't even be in this job.
Yeah. Whatever the job is.
Yeah, whatever the job is, yeah.
Yeah. Any others?
They're going to get bored.
Uh-huh.
They're going to be annoyed.
They'll be annoyed.
They're going to tell my boss about it.
Uh-huh. Okay. Okay. So would you like to be Dan or the strangers from hell?
I'll be the stranger from hell this time.
Okay, great. And my face is twitching and I'm a little nervous. And so what you want to do is point that out and ask me if I'm feeling nervous. And then you can start hitting me with all these criticisms.
Dana, are you feeling nervous right now? You look all twitchy.
Yeah, I do that when I get nervous. I am feeling kind of anxious and self-conscious right now. And my face is kind of twitching.
You look crazy to me.
I feel kind of crazy right now.
I think you are crazy.
Do you think so?
Oh, no, I'm totally sure, yes.
Yeah. Well, once you get to know me, you'll know that I have other parts about me that are a lot crazier than this.
You mean more than crazy?
Wow. Oh, yeah.
Yeah, well, I also think that you're worthless.
Oh, do you? Do you just in general because of the work that I do or just because of my anxiety or what?
Oh, don't get me started. Right now your performance just sucks. And,
actually, the interesting thing is my performance at work has been phenomenal. I've got nothing but promotion after promotion, but I have to plead guilty as accused that I do have performance anxiety, and that is a bit of a flaw for sure.
Not only that, but look, you can't even speak with a normal voice.
Is my voice quivering a little bit right now?
Oh, totally, yes.
How about right now?
Oh, even more.
Well, that's I'm guilty as accused. You sound like you're kind of pissed off at me.
Yeah, in fact, let's stop talking because you're just bothering me. I don't want to hear about this anymore.
Well, I'm sorry you're feeling bothered. Do you get bothered all the time when you're around anxious people, or just me?
Just mostly you.
Oh,
mostly
really?
You, yeah.
I'm sorry I have that effect on you. I've always liked you and thought you were a real good friend, and I hope I don't lose you as a friend, but if I do, I would totally understand.
Well, I don't know about that, but you may lose your job because I'm going to tell your boss about
I've already told him
performance you just did.
I've already told him I get anxious sometimes, and tell you the truth, he doesn't seem to care. So who's winning?
Well, of course you're winning. Yeah.
And how am I winning?
Well, you're like water rolling off a duck's back.
Yeah, and that's called the acceptance paradox, and the idea if you use it, the one who's criticizing is the one who looks goofy, not the one who's been criticized. And then I would do a role reversal with Dan as well to make sure that he can do this. Mm-hmm. And the point here is not to respond to a real person who criticizes you, because that would be very rare. Generally, people don't have these thoughts and they don't verbalize them. But who is the feared fantasy figure?
Well, it's in your mind.
Right. And who is creating this fantasy creature?
Well, we're creating it, yeah.
Yeah, Dan.
Yeah, Dan is.
Dan.
Yeah.
And so this enemy he fears is actually himself.
Yeah.
It's his own lack of acceptance of his own anxiety.
Yeah. In reality, people don't really care about us that much. They're
exactly.
more interested in themselves.
Yeah, exactly. They care how we treat them, and but it's been helpful for me too. So I can say to audiences, I've had 17 anxiety disorders. And no one's ever thrown a tomato or anything. They always say, "Oh, we're so glad you showed yourself to be human in the workshop. It makes us feel closer to you and more receptive to what you're teaching us." But we have these self-created monsters in our mind, and that's where our suffering comes from. It's internally created. Other people's judgment of us could never affect us unless you buy into it, and then it's your own thoughts that are upsetting you, not the other person. Well, this is just a little piece of the treatment of social anxiety, Dan, but it's an important piece, and maybe if you listen to this podcast, maybe you'll tell us what you think. Try out some of these techniques, bounce them off your therapist, and let us know what happens. The real question is, do you have the courage to use these techniques, because they are frightening.
Yeah, and I'd like to rephrase your word of caution at the top of the podcast, which is, right now we just threw some methods at a generic problem.
Yes,
even
that's
though
right.
It's a specific person. In fact, what you would do is you would really go down into specifics. When does this happen? What thoughts are you having? And so on.
Yes, and you'd empathize first. You'd be measuring empathy and symptoms before and after session, and you've been using a lot of other methods as well. Be doing paradoxical agenda setting. Our message is, don't just kind of throw techniques at people based on a diagnosis or a problem. Yeah. But since you, Dan, have been getting some really good therapeutic help from skilled therapists, we're illustrating that's something you might incorporate in the treatment that you're doing, and this could very well be the missing piece from the therapy. And the reason that's not trivial is because, as we've said multiple times, 80% of the therapists in the United States and Canada are themselves afraid of exposure. Mm-hmm. So they won't use these extreme exposure techniques that are so healing, because they get hypnotized by you, Dan, the patient, and thinking, "Oh, Dan couldn't possibly, do a shame attacking exercise or do self-disclosure or survey technique," and then you don't get the benefit of complete enlightenment.
Yeah. Okay. Thank you so much.
Thank you, Fabrice.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes for this podcast under the blog page, and where you can leave your comments and questions. The website has an abundance of resources for therapists as well as non-therapists, including books, workshops, a list of online training groups around the world, and much more. Theme music is Gypsy Jazz in Paris, 1935, composed and performed by Brett Van Donsel. I am your host, Fabrice Nye, and I invite you to join us next time for another episode of the Feeling Good podcast.